Hello Stephen, it's Rory from the TextPad study.
Alright, yeah.
Hi, I'm just calling to get you set up on the Zoom.
Right, it's been on charge, it's fully charged.
Champion. Right gents, we'll make a start. So nice and gentle with the arms, just keep the chest up nice and high. So we're going to lift and roll. To your side, keeping your feet flat. Come back to the centre. It's for patients with peripheral arterial disease, which affects like the lower limbs, so causes like swelling. And the sort of gold standard treatment for that is, general exercise and to stop smoking, and then improve sort of lifestyle behaviour choices like eating healthy. They get their baseline measures with the NHS and Northumbria University at the start, and then at the 12 weeks they get the same tests run again, and then we'll compare.
So today we are going to be seeing the integrated care system in action through the work that Healthworks does. I'm really looking forward to seeing how the NHS, local authorities, our voluntary sector partners come together. Morning. Good morning. I'm Bola.
I'm Karen, nice to meet
Hello
you.
Karen, pleasure to meet you.
Hi Bola, I'm Paul.
How did Healthworks come about?
So we've been going for 27 years. The model was always to be place-based, working directly in the community with the most disadvantaged.
Does everybody feel okay? Yeah, are you ready for the cartwheels and backflips on the road? Yeah.
I'm having a lot of problems with my balance and I fall a lot, but I do have other problems as well. So it's helping me in a lot of ways.
Well, we are predominantly a falls prevention exercise programme. We're all evidence-based.
It's free to access for anyone who has a fear of falling or a history of falling. They can just self-refer over the phone.
I am employed by Newcastle upon Tyne Hospital, NHS Foundation Trust, and I work 11 hours into the Stay and Steady exercise programme.
It's really important just to keep that chest up nice and hard. We're not bending. And it's just to sort of like improve that balance, but also improve that confidence. And it's to help like maintain that independence as well. So we see a lot of like improvements in people being able to like walk more, being able to do like activities of daily living better.
Some have a diagnosis of osteoporosis or have a family history of osteoporosis.
See how he's getting on over the next 25 weeks, I think we've got left.
We've got to know each other already, right? So it's really nice. And we can have a whinge and a moan if we want.
The exercise is a benefit in people physically, but we know the benefits that has on somebody's mental health as well.
And I'd like to see more people doing things like this. Yeah. It's definitely needed without a shadow of a doubt.
What was the talk on next door? Motivation. I must have we're all really motivated today then, aren't we, coming in?
All these patients have got cardiac illness and it's lifelong, even though they've been mended and they've had surgery and they've had stents, they're actually coming together within the group and supporting one another, and they're here with us. Everything with the patients is risk stratified, so we know how far to push them. We're looking at their medications a lot. We don't prescribe, but we help the GPs with titration, with letters. It's an amazing big job really that you do. I mean, I just sort of thought people would come home, got visited and came to a class and jumped around for a few weeks. It's not like that at all.
And change into a toe tap, this time out the arms in as well, build a steady rhythm.
The 6 weeks of educational talks are where we have the psychologist twice. We do a talk about how the heart works. We've also got the pharmacist who comes from the hospital who talks about the lifelong medication. We've got the dietitian who comes to talk about food, portion control, weight loss. If they've got issues with insurances, or we can just give them telephone numbers and advice really, and tell them obviously if they've got problems with their rent, or welfare rights is a really good service.
And let's change the range again, back into our heel digs, straight in with the arms.
And with the fitness instructors, that's such a good help to us. They do the shuttle walk tests, they encourage the patients and they set the exercises and they lead the group. So for all our healthcare professionals within the group monitoring blood pressure or observing the patients, the fitness instructors the eyes really, and that they're getting people, they set the weights, they know what they're doing really with the fitness and the exercise, and also encourage the patients, as we do as nurses. But I think with them, you've got just the chit chat, the music going, they build a rapport. They're such a friendly group of people.
I think I've definitely dealt with patients which probably have got a big fear of maybe having another heart attack, but what helps is being in a kind of controlled environment with the nurses.
Change back into our toe taps, a little bit quicker than last time.
You can't always mend people completely. You're living with a lifelong condition, but making small changes and we're all working together as a team is very rewarding. There's nothing more rewarding when you see a patient completing 6 weeks of cardiac rehab. They've lost a little bit of weight, they've learnt a little bit from an education point of view, they're engaging with their GPs for the regular appointments.
So I'll just wait till everybody's ready for the exercise and position and got their equipment.
I'm going to speak with Dr. James, who is one of the consultant anaesthetists at Newcastle Hospital Foundation Trust. As a clinician, he refers people into the various health interventions based out here in the community.
Organisations like Healthworks are so important for how we can target patients and intervene in a holistic manner with patients, either from outpatients, inpatients or pre-surgery, which is my field of expertise.
I've been here 4 years now, because it was like a prerequisite. If you're going to have a major operation, like I had hips, I had 2 separate hip operations, and you get yourself fit, so you recover a lot quicker.
Sure.
And it does work.
3, 2, 1, bring that to a stop, take your time, moving to the next station.
To improve the issues that we know, for me, impact on surgical outcomes, but will also impact on outcomes from an outpatient setting, with respiratory clinics, obstructive sleep apnea, fatty liver disease, diabetes. If we're not offering a holistic approach, all we're going to do is increase drug expenditure, increase complication rates, and not have the productivity that we really need within our health service.
So it's really made a difference.
Oh, it's big style.
Wow.
Big style, yeah.
That's wonderful.
No problems whatsoever.
And I really hope that the new ICS will take this forward so we can get a holistic healthcare that impacts on patients as soon as they're listed for an operation or when they're referred to a hospital.
Everybody comes because you've got crack jokes, be silly, be stupid, take the mickey, and everybody just goes home with a big smile on their face.
Wonderful.
Including the instructors.
Go for it.